Hey, Eastern Oregon, welcome to this Grande Hospital Spotlight. And today it's a pleasure for Dr. Maynard Bronstein and nurse practitioner Leah Carpenter to be with me today. And hey, thanks guys for jumping into this. Yeah.
Absolutely.
Yeah,
thanks for having us.
I really appreciate it. And Dr. Bronstein, you and I we've had lots of conversations, several conversations about cancer. I've always enjoyed the conversations, not necessarily the topic, but I appreciate your positive approach, and it's, you know, people brag about you, and they do so, you know, with good reason, because you are very positive about what sometimes can be a very complicated topic.
And you are very kind, Brent. I appreciate it.
All right. Well, let me just start with, so Dr. Bronstein, you've been here for how long? I mean, tell me your story briefly, you know, and I've asked you this before, kind of catch us up on how long you've been here and how you started doing this.
Well, I've been here for almost 12 years now. It'll be 12 years in September. I was living and working in Walla Walla and coming to outreach clinic here, and I just thought Grande is a beautiful place. I love the mountains. The hospital just seemed very well run. So I approached the hospital and asked for a job, and they ran it through the board, and I was lucky to get a job here.
Yeah, and somewhere along the line, if I remember right, you said, "Hey, I really could use some help. There's a lot that we could do if we had more help," right? Yeah.
Absolutely, yeah. So, you know, the clinic was gradually building over the years, and then I think the breaking point was COVID. I think a lot of people that previously had been traveling out of town to get cancer care didn't want to travel anymore, and yeah, I was drowning.
So in comes nurse practitioner Leah Carpenter, and Leah and I have the pleasure of knowing each other personally too. So yeah. This is kind of fun. But so when you came here, though, you had been a nurse, but you were a newly new nurse practitioner, right? Yeah.
Correct.
Yeah.
Yeah, so I have come from the Seattle area. I was a nurse for 20 years prior to going to graduate school. And then when I came here to this valley in 2018, I worked with Dr. Bronstein in palliative care initially, and then started helping him out at the clinic. And then after that, we joined forces together in 2021, I believe.
Yep, that sounds right.
And what's palliative care? I'm sorry.
So palliative care is hospice care, end-of-life care.
Okay, all right. And so had you been involved with the cancer area? And I'm sorry for my ignorance, but the oncology, had you dove into this very much before this time?
I have had some experience as a nurse working in the oncology setting in cancer care, and really a wide variety of experience, and most recently with more palliative care, end-of-life care.
Cool. And so Maynard, how have you guys been able, now with Leah on board, how have you been able to expand the services a little bit like you've wanted to?
Well, Leah was instrumental in getting us sort of up to speed, keeping up with the workflow. And what was it, a year ago, we got our new space. So
that's right.
New office space and infusion areas, so we can treat more patients with, you know, better access for the nurses doing chemotherapy infusions. So it's really helped us serve the community better.
That's awesome. And what a great thing it is for people to be able to, and we've talked about this, to be able to have this kind of care and not have to leave the valley, which is the point, right?
Yep, absolutely.
Yeah. So because someone who's struggling with cancer, that additional burden of having to travel for that treatment and so on and so forth. So this is how fortunate we are to be able to have this here in the area.
Yeah, it's burdened both time, energy, and also expense. You know, a lot of people end up traveling to another city the day before and staying in a hotel so that they can make it to their morning appointment in wherever.
Yeah. So So we're doing this segment because June is going to be Cancer Awareness Month, and so we're trying to give Grande Hospital is trying to get a little bit of extra emphasis on that, and you two were willing victims to come, and we really and we appreciate that. I know Marty appreciates that a great deal. So Dr. Bronstein, give us an idea of where is cancer in general? What are you seeing as far as trends and treatment and so on and so forth?
The trends, so right now the two leading causes of death in the United States are heart disease and cancer. It used to be heart disease, but actually the cardiologists have done such a good job of improving things and making people aware of cholesterol and those types of things. So now cancer and heart attacks are on a par. If you look at cancer trends going back at least 30 years, there's been a slow but steady decrease in the diagnosis and death rate from cancer. So we're definitely making progress, and that's something Leah's going to be able to elucidate a little bit more for us. As far as treatments, it's just an exciting time to be an oncologist. And I think it's a good thing for cancer patients as well, that there are breakthroughs. It seems like every day there are new drugs being approved. There's a group of drugs referred to as targeted therapy, and then there's another group of drugs referred to as immunotherapy, and that's really improved our treatment and let us get away from chemotherapy, which we still use chemotherapy, but I'm looking forward to the day when we can say, remember the bad old days when we used leeches and chemotherapy?
Yeah. So are you feeling like there's more hope than what there has been in the past? So, I mean, for someone who they get that diagnosis for the first time, I mean, 30 or 40 years ago, it was almost like a death sentence. Right. I mean, yeah, and so, I mean, clearly it's changed since then. But even in more recent times, do you feel like there's more hope involved?
Oh, absolutely.
Yeah.
And it's really satisfying to see some, a elderly guy like me that's been in the field for a long time. You can see things that were basic science research back in the 1980s and 90s are now in the clinic being used every day. Breakthroughs, understanding about how cancer is driven to grow, attacking those mechanisms within the cancer cells, and also understanding how cancer interacts with the immune system and exploiting that to be able to treat cancer.
Wow, very cool. And so I know the answer to this, but so then what's the key? What's the key to getting a good cancer prognosis, if there is such a thing?
Key. What is the key?
What's the key? Yeah.
So absolutely, the key to prognosis, to really a healthy lifestyle, is early detection, early cancer detection, and really early cancer prevention through detection. So people can do this very simply. For women, especially, October is National Breast Cancer Awareness Month. We really encourage women to perform self-breast exams at home for early detection, because we know our bodies better than anyone else, and so we can bring that forward to our physician if there's any changes. We say if there's any changes, don't wait to investigate. And really, having mammograms done for early cancer detection, women starting at age 45, which may actually become earlier than age 45 soon enough, but for right now it's 45, and that should be annually, that should be every year. Really don't miss out on vaccinations. HPV vaccinations will help prevent cervical cancer. Hepatitis B vaccines will help prevent liver cancer, and there's really a whole host of other types of modalities to prevent cancer and have early detection, because the more we know, the more we can live a healthy lifestyle and really avoid our office.
So talk more about, what do you mean by cancer prevention, the vaccines you mentioned, but cancer and a healthy lifestyle? I mean, talk about that a little bit more so that
Okay, yeah.
So that us a little dimmer can really understand that, yeah.
Sure. So for a healthy lifestyle, of course, we're promoting healthy eating, we're promoting good protein intake, good vegetable intake, seeing your physician annually, sharing medical information, especially new medical information with them, so they can further help you to live that healthy lifestyle.
So is there ever a time when, because certainly there's, there's that paranoia part. It's like, okay, well, I have a mole. This is a little funny looking, or, everybody self-doubts. Mm-hmm. What would you say to those people that are like, Leah, what would you say to them? It's like, is this something I really should have my provider take a look at?
Should I really check this out?
Yeah.
I would say yes. I'd say if you are worried at all, if you have any concerns or doubts, come in and see your physician. They would love to talk to you about it. They would love to walk through steps with you to, again, investigate any concerns you have.
Yeah, awesome. Cool. You have anything you want to add to that, Maynard?
Well, for moles in particular, there's the ABCD rule, which I can sometimes remember and sometimes not, that would give you a clue as to whether something is likely to be a serious skin cancer. But I agree with Leah. If you're in doubt, the best thing to do is to pay a visit to your doctor, and even a doctor looking at it, very often it's hard to tell if something is cancer or not. So then they'll take a small piece of it and send it to the laboratory and get somebody with a microscope to tell us whether it's cancer or not.
All right. So June is Cancer Awareness Month.
It is.
And the hospital is having a special activity. Why don't you talk about what you guys are doing during that time?
Sure. So yes, June is Cancer Awareness Month and really National Cancer Survivor Month. Here we're honoring those who have journeyed through cancer treatments and who are currently journeying through cancer treatments. And so this is the first ever Cancer Awareness Fun Run that Grande Hospital is putting together. It will be on June 17th, which is a Saturday. It'll be from 9 a.m. to noon. And really, registration is happening right now. So go online to the Grande Hospital website, and there should be some information for you to register there. There are also flyers that will be displayed, and you can use the QR code with your phone to help register yourself there. And so this event, we're really proud of it, and we're really excited to be part of it, because not only is it cancer awareness, and in fact we will be there promoting education for cancer awareness, so come and say hi to us when you can. And really this is for the community. Again, you bring the names of members of your family or neighbors who have journeyed through cancer or who are currently, and take the time to walk for them or walk with them in support, and really kind of try and bear each other's burdens in that way.
So Fun Run is kind of an oxymoron in my book, but where's it going to be at? Is it a run, or can it be a walk? Or talk a little bit more about that.
So this is going to be at the Grande track, right behind Grande High School.
Yeah.
Right, and Central High School. So this is around the track. It's pretty flat. In fact, it is all flat.
Yeah.
So it's can be a 5K, 3K, whatever you would like to do, really. There are different levels and different steps for different ages, etc. But it's okay to bring your family, your kids. We'll have party favors, so to speak, for the kids, and noisemakers for everyone to cheer each other on, and we encourage people to dress up and really have fun with this.
Cool.
And it's emphasizing another important point of a healthy lifestyle, which is physical activity.
Yeah. So let's drill. So is there a correlation between eating well and getting exercise and cancer?
Yes.
Certainly.
Okay. And and I think I don't know that we say that clearly enough.
Yeah.
So talk about that a little bit more.
A good example of that is breast cancer, which is one of the most commonly diagnosed cancers in the United States. And there's a correlation between obesity and breast cancer risk. And in fact, for women that have already been diagnosed with breast cancer and have gone through surgery and whatever treatments, gaining weight after cancer treatment is also associated with increased risk for disease relapse. So there's a real physiologic association there. Colon cancer also has been associated, increased risk with obesity.
Wow. Well, cool. Well, great news. And so one more time, this is June
the 17th from 9 a.m. to noon at the Grande track.
And people can register online, and the information will be on the bottom of your screen here too. So, well, thank you, Nurse Practitioner Leah Carpenter and Dr. Maynard Bronstein, for being with us today here on this Grand Ronde Hospital Spotlight, and we will see you next time right here on EO Live TV.